Does seeing something like this make you feel like this? You might have something called hemophobia, and you're not alone. But Charlotte, what the hell even is hemophobia? I know you guys are sitting there watching this video being like, you made that up. That's a fake word. Why would you say that to me? You're gaslighting me. But I promise, guys, it's real and it's far more common than you think, okay? So to define hemophobia, it's said to be like an intense and irrational fear of blood, injurious or like injection type stimuli, which can interfere with a person's ability to function in their day-to-day life. So hemophobia is not just squeamishness, all right? It's a little more than that. Up to 15% of people experience hemophobia at some point in their lives. So someone you know probably, hey, that's 15 out of 100 people, okay? So as overwhelming and insurmountable as the fear may seem, if you've experienced it, you know that it's like pretty intense. There is a way through it, so don't even worry. It's not helpless, okay? Hemophobia can develop as a result of a previous traumatic event involving like blood and guts, but some people just feel funny about it without being able to like pinpoint where it really started. But the fear itself causes you to have both a biological, so a bodily reaction, and a psychological reaction, so something that's like more emotional. What makes dealing with the phobia a little trickier than other irrational phobias is the way that it elicits in your body something called a vasovagal response. So that is when your blood pressure drops and your heart rate drops, which can cause you to feel like really dizzy and sick, and also can cause you to faint sometimes. So that's can be a little more dangerous, but it's okay because I'm about to get into the way we can fix it in a minute. One moment, please, okay? Patience. Other symptoms, of course, can include anxiousness, obviously, fear, obviously, because you're afraid of it, but also being anxious about medical procedures, right? So that means that some people might actually avoid important medical care. Like if they need to get a blood test or if they need to get an injection or vaccinated or something, they might be too scared to actually get it and they put themselves at risk. So it's really important that you get on top of it as soon as you can. So avoiding the thing, when it comes to fears, avoiding your fears might seem harmless, might seem like, that's fine, I'm afraid of it, so I'm just never going to expose myself to it. But that makes your fear much worse, okay? By having no exposure, you turn your fear from this, okay, into this. Yeah. Until it's not just real blood that scares you, but fake blood too. On Halloween and dress-up parties and stories your friends tell you and maybe even paper cuts scare you. So it's important to try and work through it so that you can continue to participate in like your life. You know what I mean? So essentially avoidance acts as a reinforcer for fear. Your brain learns that when it runs away, it's safe. So our goal is to teach the brain that there's nothing to be afraid of in the first place. You know what I mean? So at this point in the video, you're probably crying at your screens being like, Charlotte, how do I fix it? Like, please, you've been blabbing for so long. How do I fix it? How do I get over it? You said that was a way to help. And there is, okay? So take a deep breath, stop crying, wipe your nose. I'm about to tell you about the gold standard of hemophobia intervention, okay? Which is graded exposure. Yay, that's right. The very best and most effective way to minimize your fear is to stare it in the face, all right? So before you guys lose your minds, no one expects you to just like do the scary thing in a one and done, okay? Graded exposure means that it's graded in levels, all right? So you start with something small and then you slowly work your way up once you've mastered that first step, okay? There's never a quick fix to anything. Good things take time. Just patience, all right? Be kind to yourself. So let's go over how it works. So the general concept is a step-by-step approach that helps your brain unlearn the fear that you've been reinforcing by avoiding the stimuli that makes you uncomfortable, okay? It's fine. I'm not judging. It's based on classical conditioning and habituation, okay? So the point is to stay calm and train your brain and body to get used to what was once overwhelming. Getting used to it is the key part. Okay, so it's about building up a tolerance. For all you people that go to the gym, you know that the more you lift, the stronger you get, okay? So it's the same. The process of exposure therapy, so graded exposure, begins with mild triggers, like I said, something small, like saying the word blood or looking at a cartoon of a needle. And then slowly, as you acclimatise to the first levels, you move up to something a little bigger, like a real photo of blood, or a real photo of a real needle, or a video of someone getting a blood test or something. Okay, until you work up to whatever you set your ultimate goal as, which is going to be different for everybody. Okay, so the step one that you'll do before you even start being exposed to things is creating a fear hierarchy. So it's the very, very first step in an intervention program, and it'll act as like a framework. It'll be a guide for the rest of your therapeutic process. Okay, so it's much easier to approach hemophobia one step at a time rather than stress about the big picture. Okay, if you stick with it, you will see results, but try not to rush. Okay. Another good tip is to understand that during a session of exposure, your anxiety will actually increase before it decreases. So at the first 30 seconds of looking at something, you might freak out and be like, I can't do this. But then after you've been sitting with it for a minute and a half, you might be like, this literally isn't bad at all. So if you're able to push through that initial anxiousness, you will be fine. You'll feel better. Okay? So let's talk about some tools to use when you're actually in your exposure sessions. So applied muscle tension is great. So what you can do is you can wiggle your toes, clench your butt cheeks, all right? You can flex your muscles if you're like vain, you know, whatever works. And what that does is it keeps your blood circulating. So it keeps your blood pressure up, which can minimize those vasovagal responses that we talked about earlier. Okay? Deep breathing is another technique that's so simple but like really effective. It kind of is like an active, it's like a reset for your brain. Okay, it's like taking a screenshot. It's turning it off and then back on again. I know it sounds stupid, but deep breathing in your diaphragm really works. Okay, give it a go. So remember that each step forward is a win, and that it's okay to go slow, and that overcoming something like hemophobia isn't about being fearless. It's about being brave. Okay, so give it a go. If you have hemophobia, try these techniques.